Welcome to By Generations, for Generations, a podcast commemorating 50 years of the Singapore investment company Temasek, and to celebrate the people who have been part of its journey. Temasek was set up in 1974 to take over a collection of 35 companies from Singapore's government in the wake of the country's independence. This allowed the government to focus on its core role of policy making and regulations. Since then, Temasek has evolved from a holding company to a global investor. And while the company is still based in Singapore, it's supported by 13 offices in 9 countries across the world, where the company's dynamic team keeps Temasek moving forward. Back in 2008, Temasek set up its life sciences team. An early hire was Fidah Alsagoff, a doctor who, after working in hospitals and then completing an MBA, was interested in how to improve patient outcomes on a large scale. He realized that one of the ways was investment, and that brought him to Temasek. From the start, a major focus of the life sciences department was therapeutics, and they invested in a relatively unknown company called BioNtech, which was pioneering vaccination technology and would go on to co-develop one of the most widely used COVID-19 vaccines in the world. For Singapore, the coronavirus pandemic brought back memories of the SARS outbreak less than 2 decades before. And at Temasek, old contingency plans were dusted off and reworked to see how they could help their country before the virus got the upper hand. As the only trained doctor working at Temasek in 2020, Fidah was a pivotal figure in the company's efforts against COVID-19, leading projects that sought to provide sanitizers, masks, ventilators, and other much-needed equipment for Singapore's population. Today, Fidah is Vice Chairman of Life Sciences and Healthcare at Temasek, and he reflects on the extraordinary lengths he and his colleagues went to during the pandemic and what it taught him.
Since the age of 11, the only thing I wanted to do was be a doctor. I did graduate with a medical degree. And then I worked in our hospital. I decided the best specialty for me was public health. And so I did that, and I went out to join a charity. The next natural step was to join hospital management. But somewhere in that midst, I decided I wanted to train myself in general business disciplines. So I signed up for an executive MBA. But there was another moment of epiphany midway in my course where I did value creation. I was talking about how investments could catalyze meaningful innovation. And I said, that's what I want to do, but in healthcare. And what happened in 2008 was Temasek decided that contrary to what was the usual normal practice, they wanted to bring in people with industry experience. And one of the sectors was healthcare and life sciences. So I was very fortunate. I just happened to be at the right time. The fundamental responsibility for Temasek is sustainable financial returns. So whatever I did had to deliver that. But within that, you have got a fairly broad fairway. And healthcare just happens to be one of the spaces where you could get both. You could focus on the innovations that really could make a difference by investing in them. The task given to me was to grow the life sciences sector. A large part would be investments into therapeutics, biotech. Very compelling and very satisfying when investments in these companies end up successfully getting to the patient's bedside. We built in the life sciences team a global network. That is important, and so we know the importance of continuing to build relationships. I'm a builder at heart, and there were a couple of things I were given the privilege of being able to build. One was an entire global team to do life sciences investing. Temasek allowed me to shape it in terms of what sort of folks we hired. I started bringing in PhD researchers. We brought in doctors, we brought in medtech, so on. People that had the domain science, and we trained them in business disciplines, and then ran them globally. and COVID-19 showed how powerful it was. So now we enter into the tail end of 2019. Wuhan, a couple of patients with atypical pneumonia. Alarm bells started ringing, especially for people who have lived through SARS in Singapore. Around Chinese New Year, we knew something was up. We started taking preparatory measures on a just-in-case basis. And shortly after that, there was a meeting called within Temasek. Our then CEO, Ho Ching, called the meeting. We have this coming up. It could be very big. What's its implication for us? Beyond that, how can we help? When it became apparent that it was no longer business as usual, we were shut down, Temasek, I think, really came to the fore. And it wasn't that people needed prodding. And the realization or the stance that we took was, this is a time where we must help the communities in which we work in. So therefore, it's a question of what we as Temasek and we as the Temasek ecosystem of companies, are there ways in which we can help? And so work streams started evolving depending on what we thought was going to be needed in the evolution of COVID-19. My job was to watch over everything, to be sort of a chief of staff, to track all the work streams happening, to do the engagement with whether it is our government partners or the private sector, and just galvanize the whole ecosystem. So that took a life of its own. So within that, we actually end up drafting volunteers in. We had about 700 or so staff at that point in time. Up to 450 were actively involved, willingly, which told me a lot about Temasek. I was very, very proud of everyone. Because we're generally investors or people with specific functions to support the investment activities. And the most amazing experience for me was when we were asked for help to send a team into the migrant worker dormitories to do testing, and we're talking about live COVID cases. We had a team that volunteered. They wouldn't step off. They kept going every day, full PPE doing the swabbing. And I said, do you want to step off? They said, no, this is important. Blew my mind. These are special people. And it's been a great privilege to work with them. "2020 was the most tiring year of my life. There were exigencies to grapple with for which the failure to deliver was not an option. No beds, what's going to happen? No diagnostics. There was a period we had no swabs. When Milan went down, we learned that there are only 2 suppliers of swabs in the world. The Humble swab had 2 major suppliers, one of which is in Lombardy, which is just where Milan is. We had no swabs in Singapore. It doesn't matter if you have diagnostic kits. We have nothing to swab it with. Then we had no collection media. After you swab, we didn't have it. Singapore wasn't getting access to these supplies. We had to scramble to find solutions. And they generated a lot of stress. And then when we had a diagnostic kits, how do we make sure we had access to these things? Because absent a treatment, we had to prevent people getting infected. And after getting infected, we need to corral them, keep them well, sort of comfortable, treat them well, but separate them from everyone else. How do you do that? And we have to work it out from scratch. And then there are 2 jobs happening. There's a wider Singapore and world-facing, which is the COVID task force that within Temasek that we've been talking about. There's the other bit, which is the protection of my own colleagues in all our hospitals. And when it's your own colleagues and their families, and I know many of the families of my teams overseas, it makes it very real. The first guiding light, if you will, for us was sitting down and coming to grips with the concept of an exponential enemy. So then the first couple of decisions that we did in Temasek, one was the realization that we have to stop the spread as far as possible, prevent person-to-person transmission. You need the mask, you need a sanitizer. We didn't have masks. How do you solve for that? So then a whole work stream happened along with a lot of civil groups. So your own masks, do all sorts of stuff. And ultimately, ST Engineering brought a production line back into Singapore. Sanitizers were going at $27 a bottle early on. And it's really bread and butter. Everything you touch, sanitize. It's actually chemicals, very cheap. So that wasn't difficult. The Temasek Foundation then rolled out, let's just get this out to everyone and make it a commodity. And so sanitizers, then the market was broken. And people were free and comfortable using it liberally. The less obvious but important step we did was when we look at the data, we had the benefit of looking at New York. New York went in flames before we did. The moment a hospital is overwhelmed, mortality rate goes from 2% to 10% in days. And doctors and nurses do things they are fundamentally not suited and untrained to do, which is decide who lives and dies. And the scarring on their psyche is irreversible. We had to stop that. And so we had to create beds. So first, where can we build the beds? And Delam Pillay, our current CEO, was telling us a story of how his wife had watched a documentary. London Expo was converted into a makeshift hospital. Now, the Singapore Expo is part of our portfolio. No business, right? Everything was shut. Could we do that? And answer is actually we could, because within our portfolio, we had Tan Chong Meng, who was then the group CEO of PSA, brought to the fore. He is a formidable mover of systems and people. We had got urban planners like Sabana Jurong. So the CEO then, Wong Heng Fine, came along. We planned it, executed it, and delivered up to 10,000 beds in the expo, ready to open. We needed 4 weeks to build, which is not bad, 10,000 beds in 4 weeks. By the last week, our friends in MOH came to us and said, we need beds. Can you give this to us? I said, sure. How long do you need? They said 4 days. Thank God we had prepped. So that was important. We never went beyond capacity, ever. You add on to it, then we looked at it in discussion with our partners. Actually, they led much of it. The MOH, the Ministerial Task Force, we supported where we could, but where we could support was getting new beds quickly. Part of it was quarantine beds, which is, you're not sick. We're not sure though. Let's house you. I remember Tan Chong Meng teaching me about what a flotel was, which was a floating hotel. We brought in that. There was a couple of thousand. We built up tents in Tanjong Pagar, which was now empty. We converted schools that were empty instantaneously. And so we always had a buffer. This was whole of Singapore society at its best. It was a once-in-a-lifetime, I hope, lesson, and it really stretched me. I learned a lot about myself. I needed to get rid of the cortisol that was pumping all the time. So I forced myself to exercise like a fiend. So I really, really pushed. I think I exercised more than I ever did in my life, and that helped. I needed to also look after myself mentally. I learned about mindfulness. I learned to be grateful for little things. Stop. The world will go on fine for the next hour. I'm not the savior of the world. I learned to be present. That was actually good for me. I'm always living in tomorrow. COVID taught me to live in today. The impact of the experience we went through in COVID really was realizing that when you deal with such a pervasive invader, it is beyond the Ministry of Health, it is beyond whole of government, it must be whole of society. And when whole of society came together, powerful things happened. Singapore, to my very pleasant surprise, was top of the league table for the trust that people had in their government's handling of COVID, which is nice, but it really was a whole of society. My hope is we never forget that it is whole of society. There is a role for non-profits, civic groups, the private sector, alongside the civil service when dealing with these things. My hope is that Temasek goes on to much greater success and that we always remain uncomfortable with status quo, that we have the courage to challenge and transform ourselves so that we are always relevant, and that we never lose sight that we are stewards. Everyone wants to do their best out of a sense of stewardship. We want to always build with tomorrow in mind. So we want to be stewards for tomorrow's generation. We also have learned that we must be grateful for today, which was yesterday's tomorrow, and for the older generation that built it for us. So we honor all. This is who we are.
You've been listening to By Generations, for Generations, a podcast commemorating 50 years of Temasek. To learn more stories about the people who have been part of the company's journey, head to Temasek's 50 by 50 website, tmsk.sg/50 by 50. That's 50x50. Next time, we meet the woman who has transformed Temasek's commitment to sustainability.
My hope for Temasek is to be a trailblazer, to not just generate financial returns, but also generate positive impacts for the environment and society.
Until then, goodbye.